Let me start with something that might surprise you. Most doctors don't earn less because they work fewer hours. They earn less because they're undervaluing the work they already do every day. For years, we're taught one message in medicine all the time: see more patients, work harder, push through exhaustion. But here is the truth. I learned that the hard way. That model is exactly why so many physicians are burnout and underpaid today. If you want to earn an additional $50,000 to $150,000 per year, the answer is not longer days or packed schedules. The answer is learning how to work smarter, practice more thoroughly, document accurately, and design your schedule intentionally. Once you do that, income rises naturally, even as hours go down. So number one, stop measuring productivity by patient count. The biggest mistake doctors make is equating value with volume. Seeing more patients in shorter visits often leads to rushed care, poor documentation, unpaid work, and endless after-hours charting. When visits are longer and more intentional, you capture the full complexity of care, prevent future problems, and get reimbursed fairly for the work you do. Fewer patients plus higher quality of visits equal higher revenue. Number two, use preventive care as a revenue, and care anchor preventive visits are one of the most underutilized tools in primary care. Annual exams, annual wellness visits, screenings, or risk assessments. These visits improve patient outcomes, strengthen the relationship with patients, reduce downstream costs, and significantly increase revenue. When done correctly, they allow you to address multiple issues in one particular visit, ethically and thoroughly. This alone can add tens of thousands of dollars per year without increasing workload on you. Number three, master documentation. It's not busy work, it's income. Here is a hard truth. If it's not documented, it didn't happen financially or legally. So remember that. Most physicians do far more medical decision-making than they record. That gap is where income is lost. When documentation is structured, intentional, and prepared ahead of time, you reduce no time, protect yourself legally, and accurately reflect that work you already did. These shifts alone can raise revenue dramatically without seeing a single extra patient. Redesign your schedule for energy, not exhaustion. Burnout doesn't come from medicine, it comes from poor systems and constant depletion. When you redesign your schedule, fewer days, longer visits, better preparation, something powerful happens. Your focus improves, your care improves, and as well your documentation improves. And what else? Your patient notices that and your income follows. I have seen firsthand that working 3 focus days can be more profitable than 4 or 5 chaotic days. Number 5, patient benefits more than you think. This isn't just about money. Patients benefit enormously when doctors aren't rushed because they better listen, earlier detection, fewer misdiagnoses, stronger trust, better follow-through. When doctors are well supported and fairly paid, care quality rises. This is not selfish. This is sustainable medicine. The bottom line, you don't need to work harder to earn more. You need to work with intention. Doctors who learn how to structure visits properly, capture preventive care, document accurately, and design humane schedules regularly increase income by $50,000 to $150,000 per year while reclaiming their time and their energy. Medicine doesn't have to cost you your health, your joy, or even your family. You deserve a career that is financially fair, emotionally sustainable, and deeply meaningful. And yes, this is totally possible. Hi, I'm Dr. Jerina Gani, and I help physicians work less, earn more, and fall back in love with medicine. I also do that for nurse practitioners and physician associates who have their own patient panel in primary care.